Good afternoon, and thank you for joining us for this community briefing on COVID-19 and our local response. Joining me again today is interpreter Francis Beauvirage. Thank you, Francis, for being here. And thank you also to the media and all the residents tuning in to this briefing. We want to remind everyone that you can find the most accurate, timely, and reliable information at our website, covid19.lincoln.ne.gov, where you can learn more about how to protect yourself, your family, and our community during this pandemic. Moving on to today's public health update, we've had one new person with a confirmed case of COVID-19 reported today, in addition to the 6 new people reported from this morning. That brings us to a total of 7 new people in Lincoln diagnosed with COVID-19 today. This means that in the last 4 days, we've had 29 new cases confirmed, and we've seen the total number of people with lab-confirmed cases rise from 63 to 92. We want to remind everyone out there that the online dashboard we unveiled yesterday can be found at covid19.lincoln.ne.gov. It gives a very good picture of the status of COVID-19 here in Lincoln. And to provide further details on the health department's investigations into the newest diagnosed cases of COVID-19 in our community is Health Director Pat Lopez.
Good afternoon. We have the 7 new cases today. Of them are 2 women and 5 men, ranging in age from their 20s to their 70s. We are investigating and identifying close contacts. 2 of our community members are hospitalized at this time, and both are currently on ventilators. Nebraska now has 1,652 cases and 35 deaths. And again, one of those deaths was in Lincoln. Our positivity rate is now 3.8%, and the state rate is about 10%, and nationally it's nearly 20%. You'll remember at the very beginning of the pandemic, we talked a great deal about the importance of flattening the curve. We knew that the number of cases was going to continue to rise, but we need to all do what we can to prevent a sudden spike in cases that would overwhelm our health system. Due to the community's cooperation and following recommendations, we have prevented that spike. And although we are now seeing cases rise more rapidly, our community has had the precious gift of time to make sure that we are ready to respond. Our unified command staff meets daily with the hospitals to ensure needs are being met, and we have surge capacity. We also meet weekly with other healthcare providers, long-term care facilities, community and cultural centers, and a variety of other community partners and businesses. We provide them with prevention information and help them overcome barriers for testing and education. We also seek their input on future planning and policy measures. As I said, the people in Lincoln have done an excellent job of protecting themselves and others, but we cannot let up now. We expect to see the number of cases continue to rise through April, and we must continue to stay home, stay healthy, and stay connected.
Thank you, Director Lopez. And I want to echo her words of appreciation to all of you who are making sacrifices to protect the most vulnerable among us here in Lincoln as we fight COVID-19 spread. You've been our partners, and we appreciate so much what you are doing to continue to practice physical distancing, to wash your hands, to wear a face covering when you're out in public, to limit your trips to essential errands. Thank you for what you're doing to help us prevent that spike. Another reason that the number of people being diagnosed with COVID-19 here in Lincoln, the reason that it's gone up more lately, is because we've had an increase in testing capacity, which is, of course, a good thing. Increased testing is one of the ways we can defeat this virus. Drive-through testing continues to be offered by CHI St. Elizabeth and by Bryan Health. These sites, as we've mentioned this week, have the capacity to do 150 tests per day. Yesterday, we had 86 tests taken, and that's good, but it's still only about 60% or less of the capacity that they have to do testing here in our community. So if you have COVID-19 symptoms, fever, cough, shortness of breath, You can go get tested now. You don't have to be in what used to be a prioritized group based on age or status of your medical conditions. At this point, if you have these symptoms, please go online to bryanhealth.com or chihealth.com and fill out an easy online questionnaire. The testing is safe and easy and quick, and with the results are now coming back in about 48 hours. If you have trouble accessing care through a medical provider, you can always call the Lincoln-Lancaster County Health Department at 441-8006, and they can assist you in seeking a test if you need one. Moving forward, we certainly expect to see most of the cases here in Lincoln of COVID-19 to be community acquired. That's because it is spreading in our community, and we need to assume that there is a risk of exposure anytime you're out in the public space where other people are present. So again, this is the reason we need to limit our interactions with people outside of our own households for the time being. If you are sick or if someone in your household is sick, stay home. And if someone in your household is sick, you as well, everyone else in the household needs to self-quarantine and seek advice from a medical care provider or the Lincoln-Lancaster County Health Department. Today, along with all this talk of isolation and quarantine, we are focused on finding new ways to connect here in Lincoln. Last Friday, I spent some time speaking about how there may be an opportunity in the midst of this crisis to uncover and draw upon our deep wells within each one of us of love and compassion, and to strengthen our bonds with our neighbors and our community. In this spirit, and in honor of National Volunteer Week, I am pleased to announce the launch of a volunteer-focused city program called NeighborLink. That's Neighbor LNK. NeighborLink facilitates personal connections in our community by directly linking local volunteers with people in Lincoln who are homebound or seeking additional support as a result of this pandemic. This additional support may include picking up food or medications, as well as making phone or video calls to foster deeper connection. In these days of physical distancing and isolation, it is so important that we not only offer each other support with access to food and other basic needs, but also offer each other the gift of friendship and deep listening. Our NeighborLink program will be administered by the city's Aging Partners Division in collaboration with the Seniors Foundation and Lincoln-based anchors of Service Space. We know that social isolation is a challenge that many seniors face, both before and especially during this pandemic. Just today, Dave Holmquist, the volunteer state president of AARP Nebraska, shared with us in a Lincoln Journal-Star local view that more than 30% of Nebraskans over the age of 65 live alone, the second highest rate in the U.S. after the District of Columbia. Nebraska also ranks third in the country after D.C. and North Dakota, with about 23% of our residents over the age of 50 living alone. We in Lincoln have the power to reach out and let our seniors and other homebound neighbors know that just because they live alone, they need not feel alone. Here to discuss more details about NeighborLink and how to be a part of it is Randy Jones, director of the city's Aging Partners Division. Randy, thank you for being here.
Thank you, Mayor. At Aging Partners, we're in constant contact with hundreds of seniors in our community. And one of the things that we've been hearing from seniors is there's many people in the community that are isolated, and they're in need of support, particularly the senior population and also persons with disabilities. We've also been hearing from many community members who are also interested in helping and lending a hand. So we saw this as a great opportunity, and this has motivated us to develop the NeighborLink LNK program. The program will involve pairing of eligible homebound individuals with volunteers who are ready and willing to serve them. Services could include grocery and food pickup, medication pickup, maybe it's picking up library books, or a friendly video and occasional phone call. There's a few important details I'd like to share with you about the program. First, at this time, only seniors or persons with disabilities, and I would classify seniors as those age 60 and over, are eligible to participate as recipients in the program. Secondly, at this time, only accepting volunteers who are age 19 years and over. And for security purposes, or safety purposes, I should say, the volunteers must complete background checks, which the city will perform, as well as undertaking a brief training prior to being paired with the homebound senior. And third, finally, to minimize the spread of the virus, of course, it's very important that we take precautions due to the COVID virus, including contactless delivery of materials, undergoing temperature checks on a daily basis, and wearing face coverings. And we'll train our volunteers to do this and insist that they follow these procedures. If you're interested in participating in the program, whether as a volunteer or if you'd like to be a recipient of the program and need additional support, please go to our website at lincoln.ne.gov/aging, or you can simply call us at 402-441-7575. We're really excited about this program and what it could offer to all the parties now and perhaps in the future. This is a great way for us to stay connected and prevent physical isolation and from becoming social or emotional isolation. It's also a wonderful way to serve your neighbor in a meaningful and safe manner. A big thank you to the Seniors Foundation and Service Space for partnering with us in this endeavor. Thank you.
Thank you so much, Randy, to you and your staff for your development and stewardship of the NeighborLink program, as well as to your compassionate leadership during this time. We really count on Aging Partners all the time, but especially now. As Randy mentioned, the city is partnering with the Seniors Foundation in this effort, and I'd now like to welcome one of our special guests here today, John Crohan, president of the Seniors Foundation, and he's going to share a few words with us. John?
Hi there. Good afternoon, everybody. Thank you, Mayor. I do serve as the Seniors Foundation Board of Directors President here in Lincoln. The Seniors Foundation has been supporting Aging Partners by raising funds for services and programming for nearly 40 years. The core purpose of Seniors Foundation is to help seniors lead better lives. The foundation couldn't be more excited about the NeighborLink program and its abilities to link volunteers with seniors in need in the community. The CDC reports currently that 80% of deaths related to COVID-19 are individuals 65 years of age or older. NeighborLink will be a program that will provide a service for seniors in Lincoln to assist them in protecting in place, increasing their safety, while also providing them a new relationship, increasing their well-being through a friendly call or maybe a video chat. The Seniors Foundation is excited about the positive impact this program will have on the community of Lincoln. To learn more about the Seniors Foundation and the way we support Aging Partners and our work with Victory Park, please visit us at seniorsfoundation.org. A special thank you to the Mayor and also the Executive Director of Aging Partners, Randy Jones, for allowing me to represent the Seniors Foundation today and to support this new and innovative program.
Thank you so much, John. Really grateful for your service to our community and your commitment to providing excellent quality of care and independence of life to Lincoln's senior population. Thank you so much for being with us today and for supporting the NeighborLink program. And on that note, I am also honored to be joined today by another person who has displayed remarkable commitment to our senior population, as well as a passion for neighborhood-based service and relationships and local volunteering. Councilwoman Tammy Ward previously served as the executive director of the Seniors Foundation, during which time she helped lead the development team that successfully persuaded the U.S. Department of Veterans Affairs to select the Lincoln VA campus as the site for the new community-based outpatient clinic after nearly a 7-year search. She has also served with Tabitha Healthcare and Lincoln's Downtown Rotary Club number 14, and she represents, of course, Northwest Lincoln on the City Council. Councilwoman, thank you so much for joining us today. We'd love to hear from you.
Thank you, Mayor, and thank you so much for, I'm honored as well and grateful to be part of today's big launch. I'm particularly pleased to be speaking alongside Randy Jones and John Krogan, who I consider to be my friends and partners in serving seniors in Lincoln. And I've had the pleasure of not only working with them at the Seniors Foundation, but also my own business, where we all continue to serve through our organizations, the seniors here in Lincoln and in our other communities. The aging population and population of persons with disabilities have always been a real passion of mine, not only professionally, but also personally. I was the senior care navigator for my own parents before their recent passing, as some of you know, and I also served as a volunteer advocate for a man living in a group home for over 15 years before his recent passing. So I'm particularly pleased to join today in the support of the launch of the NeighborLink program. There has been an amazing outpouring of compassion in our community, of people wanting to serve in whatever way they can. For those looking for opportunities to contribute their time, energy, and generosity of spirit to our community, this is a wonderful, wonderful way to serve. While COVID-19 has had and taken a large toll on so many in our great city, it has had an especially large toll on our senior population and on persons with disabilities. Much of this toll is not visible to the larger community as it takes the form of social isolation and loneliness. Some have reported to us it feels like the walls are coming down on them and they miss seeing their family and their friends. We know that persistent feelings of social isolation and loneliness can lead to a higher risk of developing certain mental and physical health conditions like heart disease, high blood pressure, and depression. That's why it's so important we have strong relationships with one another during a difficult time like this, especially with those who may currently be isolated and may otherwise lack a consistent connection to the broader community. Such relationships like this can actually save lives. For those who commit to volunteering in this program, we say a big thank you. Your service is so deeply appreciated. My hope is that connections fostered by this new program last well beyond COVID-19. It's been projected the number of people age 60 and over in Lancaster County will increase by 12% in the next 5 years. Regardless of COVID-19, it's so important we create these ties within and between our senior population and the rest of our community. I'm excited about the potential of this program to foster lasting intergenerational bonds. Mayor, thank you again for the opportunity to be present today.
Thank you so much, Councilwoman Ward, and we appreciate your dedication to supporting residents throughout the community, including those residents who may be struggling in silence. As Councilwoman Ward noted, our intention is that this program supports the development of strong relationships between volunteers and the neighbors with whom they're paired. Because we recognize that such relationships, they don't happen overnight and that they can be difficult to build through a phone call, and that volunteers also need support. We are partnering with the Lincoln-based anchors of Service Space. Service Space is a volunteer-run organization that leverages modern technology and draws upon multiple personal and relational practices to support the building of enduring and nourishing social ties rooted in small collected acts of service and compassion. And Service Space is offered to provide ongoing support to volunteers in the NeighborLink program through regular video forums. So these forums will give volunteers an opportunity to connect with one another, to raise questions, and to further develop their skills critical to their success with these paired relationships through NeighborLink. Skills like deep, compassionate listening and being present for others. With these forums, we intend to provide a transformative and bonding experience among our volunteers as well. The volunteer relationship, of course, is a special one because it enriches all involved. It's been said that volunteering is the ultimate exercise in democracy. You vote in elections once a year, but when you volunteer, you vote every day about the kind of community that you want to live in. We want to thank all of those who have answered this call to service. You make this community worth living in. And once again, if you would like to be a part of the NeighborLink program, whether as a volunteer or as an eligible homebound senior seeking support, or someone with disabilities who would like to be paired with a volunteer here in Lincoln, please go to lincoln.ne.gov. The keyword is NeighborLink. And there's also, of course, a link from our COVID-19 website, covid19.lincoln.ne.gov, in the How to Help tab. Or you can call Aging Partners at 402-441-7575. And now for some other good news that we'd like to share today. Due to generous donations from the University of Nebraska, many community requests for hand sanitizer have been filled recently. This included a request of UNL that came from Lincoln Littles, and they got 53 2.5-gallon containers of hand sanitizer that's going to be distributed to local child care centers. Thank you so much to UNL for their support. Schneider Electric is donating 67 face shields for greater distribution by our health department. And we want to thank so much to Brad Pining and the folks at Schneider for answering our call for help and support. And finally, in good news for nonprofits and businesses here in Nebraska, our state was among the top 5 in the nation in Paycheck Protection Program loans approved per capita. We attribute this success, of course, to the diligence of our businesses and nonprofits as they applied and the strength of our lending institutions here in Nebraska. We really want to thank all of those lenders who worked around the clock and over the weekends and tirelessly to implement a very complicated program and to respond to their clients' needs. As Congress works to put additional money into the Paycheck Protection Program, we will keep you updated on these opportunities, and that you can find them on our Business Resources tab of covid19.lincoln.ne.gov. And now, I'd love to open it up for questions. We have Health Director Lopez here, Aging Services, Aging Partners Director. Randy is here as well. And if you have any questions for our panelists, please fire away.
Question from Kayla and for Pat.
Okay.
Is there a reason why we aren't reaching our testing limits in Lincoln? Is it because of screening concerns, or not as many people are showing symptoms?
The question is about why we're not reaching our testing capacity in Lincoln. Is it about the screening effort? Come on up.
Thank you for that question. It's more about people knowing that testing is opened up and available now for those who have symptoms. For so long, it's been so tightly controlled, and so that's why we're taking the opportunity every day to bring it up and try and get the word out. We met with our cultural centers today, and we've gotten that information out. And we've also worked through the public school system to get the information out to their employees and families in the community, too. So it's mainly because we just haven't had the testing as available because of the restrictions. So we're hoping to see a big change in this coming week.
This is Riley from the Journal-Star with a question for the director.
Good afternoon, Riley.
You ran away before I got to get you while you're at the podium. I just wanted to clarify. So of the total amount of cases, you said only 2 are hospitalized and those 2 patients are on ventilators. Is that correct?
Yes, correct.
Any other questions? All right, well, thank you again to our guests and to Aging Partners and the Seniors Foundation and Service Space for helping us launch NeighborLink. We're looking forward to connecting folks in our community. Please volunteer if you'd like, or sign up if you're eligible, once again, at lincoln.ne.gov, and the keyword search is NeighborLink, Neighbor LNK. We'll see you tomorrow at 3:30. Thank you.